to my channel. Today I'm going to be talking about dental assisting. I am a dental assistant. I've been a dental assistant for 3 years, and something that I think is the most important thing to know with dental assisting is you can't be hard on yourself when something doesn't go right. You have to be able to just move forward and understand that every patient is a different slate. It's a clean slate. It's a fresh start for you to be better. And every day you should focus on 1 to 3 things that you're going to improve within yourself. So in dental assisting we have expanded functions, and these are things that we can perform. These are certain job duties that we can perform. So one expanded function that I am certified in is retraction cord. And what retraction cord is when a patient comes in for a crown, we need to kind of push the gum tissue away. So we do that by using 2 cords. Most doctors utilize double cord method. Some doctors do single cord, and it just is completely up to the doctor that you're working with. But that is something that I can do with my certification, and I just feel like I'm getting better and better. And each day I'm like, okay, I'm gonna pack amazing cord today. Like, I just talk to myself and just really positive things and just kind of optimistic mindset about it, so that way when it comes to packing the cord, I'm already set up for success. And then when it doesn't go right, I call the doctor and I'm like, yep, I need your help. But I mean, you just have to focus on things, and so you get better and improve, and just understand that you're not going to be perfect at everything. As much as you want to be, you're not going to be. There's always room for improvement, especially with a can-do attitude. To be an assistant, I do believe you do have to have a can-do attitude. That's just going to be life-changing for you. Just realize that you're not going to get along with every single patient. You're just not going to agree with everything, and that's okay. How do you know if you would be good as a dental assistant? Well, you kind of look up what the job duties are, and you figure out if that's something that sounds like it's something that you would be good at. Easy enough. And I just want to tell you guys a funny story, because I actually almost quit dental assisting school. So if you've ever had braces, or you know someone who's had them, they kind of explain to you, oh my gosh, they had this icky goop stuff in my mouth, and it just felt like I was gagging. Well, those are called impressions, and we took impressions at school. We came back from Christmas break, and they were like, okay, we're going into the lab, we're going to take impressions. And I'm just like, oh my gosh, like, we're taking them on each other now, so this is the real deal. And I could not mix the material fast enough and get it in the mouth to save my life. And granted, before we did do the alginate impressions on typodonts, which are not real people, so we did that. And then when we started to do it on each other, that's when I got like all nervous and just weird about it, and I couldn't do it. And there was material all over my people, like the people I was working on, their mouths. It was horrible. And that's actually how I met one of my really good friends, so shout out to Shelby. Love you, girl. She was my patient, and she hated me after that. But I honestly think I went home crying that day, because I'm like, I'm quitting. I can't be a dental assistant. I'm not good at this. Oh my gosh. And now, today, I have no problem with it. Obviously, it's been 3 years later, so I would hope that I would be better or have some sort of improvement. But with dental assisting, you can't be mad at yourself, and you can't be hard on yourself, because not everything is going to click for you, and not everything you'll get right away. You have to keep trying, and you have to just work towards self-improvement and being better every single day. I wanted to be in dental for so long. I knew since the 3rd grade that I was going to do something with teeth. I brought my toothbrush to school, I brushed my teeth, I just was fascinated by teeth. Every Christmas I would ask for one thing and one thing only, which is teeth whitening. So I've had so many different bleachings done to my teeth. Everybody's like, oh my gosh, I want my teeth to look white like yours, and what did you do? And it's not like I did one-time thing. I've been whitening for years and bleaching and trying all these different products for years. Now I probably wouldn't bleach more than once a month, just because if you continue to bleach your teeth will become blue. And who wants blue teeth? Not me. I would say you'll be successful at this if you're able to multitask, you're able to handle a lot at once, you're able to Be organized. You're very good with your hands. Manual dexterity is really important in this job because you are doing everything with your hands, especially when you're chairside assisting. And a common misconception of dental assisting is that all we do is hand instruments to the doctor every day, all day long. That is totally not true. We are doing a lot of other things throughout the office and the practice on a normal day-to-day basis, and we still manage to keep our sanity. But I just think you should talk to somebody who's in the career or who's in the dental field so they can give you information and help for you to make an intelligent decision. But I am very happy as a dental assistant. I have no regrets. I'm very happy that I chose this career in this field because there are so many opportunities in the dental field, which I don't think people know that. There's dental sales, there's different specialties you can go into. You can go on to become a hygienist, you can go on to become a doctor, you can become a dental therapist, which is kind of similar to a dentist, but not really. You have to look up the job description. So the opportunities are endless, and I just think that's amazing because there's room for growth. Like when I'm old, I don't think I'm going to be a dental assistant. I'm 24 now, but when I'm like in my 40s, I don't know if I'm going to still be doing a dental assisting because it's very hard on your body. Dental assisting, I mean, you're bending over, you're constantly standing. You've got to be able to give your body time to rest when you're at home, and you have to be able to take care of your body. And I just wanted to touch on one thing real quick. You have to understand what your priorities are and what you're looking for, because there are so many offices out there, and that's kind of why I was looking for so long to find the perfect office that fulfilled all my needs or checked all the boxes, just because I knew that there was a place out there for me that I was going to be able to be successful at and be happy and enjoy my work every single day. And work is really important to me because I'm going to be there for a long time. I'm going to be there for a lot of the time during the day. I mean, we spend the majority of our time in the day working, and we spend the majority of our life working. So why not work for a place that I feel good at, I feel happy, and it's fulfilling my needs. And just understand that my priorities are completely different than your priorities. For me, I might want to be at a super busy office. I might want to be working with a doctor that I can get along with. I might want to work for a place that has really good team practices. They're always, doing events and other things. There's a lot of different areas in dentistry that you can choose. You can choose what works best for you, and understand that what works for me might not work for you, and what works for you might not work for me, and I just have to be the one to decide, is this something that I'm going to go through with, yes or no? And for me, I know exactly what I want. I know exactly what to look for when I'm looking for an office, and I've done a lot of temping to help me figure out, okay, this is something that I do like, this is something that I don't like. And that's kind of why, going back to the whole observation thing, just really understanding what goes on in that practice. Do you notice gossip? Are you liking the way that the lady at the front desk answers the phones? Are you liking the whole process of when a treatment plan is presented? What's the whole dynamics of the office? You have to know that stuff before accepting the job, because if you accept the job with the perception of it being one way and then it's completely the opposite, you're not going to be happy, and you're either going to stay there or you're going to leave. And I just think job satisfaction is everything in today's society, just because it has such a toll on you and effect emotionally, and you don't want to be bringing home the drama of the day and just how it's affecting you, because that's going to affect you in your personal life, and it's going to affect your family, and nobody wants to go through that. So just be, informed and aware that it's a big decision choosing which office you want to work at, and just understand that you're not stuck, because there are so many offices out there, but you do want to keep your reputation good. You want to keep it so you're not a job hopper. And for me, I was a job hopper. I'm not ashamed to say I was a job hopper, because I knew that what I was looking for was out there, and it just took me a while to find it. And today I'm so grateful, I'm so blessed for where I am at, and I couldn't be happier with the office that I'm working at. And it's just amazing to think, okay, I prayed for this office. I prayed for God to put me in this position, and it's just incredible. It's just incredible to think, okay, I started here and now look where I am. And I can't wait to see where I'm gonna go. Well, if you liked today's video, don't forget to like and subscribe to my channel. I will be linking all my social media links below. So if you do have any questions or anything that you want to talk about being a dental assistant, I would love to answer any of your questions. Just send me a message and I will get back to you.